Good afternoon, everyone. Welcome to another Bermuda Health Council community discussion. Today, we are going to discuss something very important. It is around geriatrics and COVID-19. One of the things that the Health Council is here to provide to you is to regulate, coordinate, and enhance the delivery of health services here in Bermuda. And as part of that mission, we want to bring you information that's going to be helpful towards enhancing your health and enhancing the health of our communities. So today we'd like to welcome Dr. Kieran Walsh. He is the clinical director at the British Medical Journal. More specifically, he is the clinical lead of the medical education and clinical decision support products at BMG, including BMJ's Best Practice. Dr. Walsh, welcome to Bermuda virtually and welcome to our community discussion.
Hi, Ricky. Thank you very much for having me. I'm delighted and honored to join you and very much looking forward to the discussion.
Absolutely. So we just want to start off and get right into the topic, but we want to get to know you a little better. So Dr. Walsh, how did you become the clinical lead for such a prestigious science body that is represented by the British Medical Journal?
Well, I'm a doctor by trade, and I trained in general internal medicine and geriatric medicine in Ireland and in the UK, and started off at BMJ around 16 to 17 years ago now, initially as an editor on BMJ Learning, and then slowly evolved into an educator, and then started to widen the remit to do other digital education resources and indeed clinical decision support resources, the most relevant resources being BMJ Best Practice, as you mentioned, and BMJ Learning. But I guess there's a geriatrician, an editor, and an educator I found have a lot in common. What we're ultimately trying to do is to communicate and to work with teams, and so I've tried to develop skills and take them with me in the various things we're trying to achieve.
Yeah, well, now that we know that a little bit about your background, it's good to know that you have very specific expertise and you brought a lot to the table in terms of the research and the information that's out there. COVID is on everyone's mind. And one of the things that we all rely on is some of the research that's out there in helping people to understand what's going on in this pandemic. What do you consider some of the contribution that BMJ is having in terms of understanding some of the research and some of the items that are happening within this pandemic?
Well, I guess one of the most important things really is the pace of scientific change and the challenge that doctors and other healthcare professionals have in trying to keep up. So remember, when we first launched our first topic on COVID-19 on BMJ Best Practice in February, I think, 2020, and it had 100 references. I thought, gosh, that's incredible. This new disease is only 30 or 40 days old. It's already got 100 references. Today, the same topic has over 1,000 references. If you look at PubMed, be it BMJ publications or other publications, you'll already see thousands and thousands of original research articles, systematic reviews, commentaries, editorials, opinion pieces. And so it's almost impossible for healthcare professionals to, number one, to learn off the required amount of information, and then to keep up with this incredible pace of change which has evolved over that time period. And so that's why we think that providing online resources that healthcare professionals can access at the point of care, that will be practical and that they can trust are continually updated, will make a real difference. And there's a number of different resources out there, whether they come from BMJ or other potential providers. But I think it's that need for healthcare professionals to stay continually updated and is something that we're trying to satisfy.
Right. And so when you talk about keeping updated, you talked about there are thousands of references now in some of these articles. And that says a lot that there's a lot of people contributing to the work. As a healthcare professional or even as a member of the public, how do you decipher which of the information out there is valid, which of it is good information versus which of it may just be someone's opinion?
Well, on BMJ Best Practice, we're lucky we've got an entire team that's dedicated to this, not just in COVID-19, but a range of other diseases. And the team includes information specialists who are continually scanning the literature through to clinical editors and digital editors who are working through the content. We've got in-house pharmacist expertise who can check drugs and drug doses. We also have external experts, authors who are leading lights in their field, but also must be practicing clinicians. And at the same time, we've got independent peer reviewers from different institutions who are checking the work as well. And we've got multiple processes to ensure that the content is reliable and continually updated. And also it's about portraying the information for healthcare professionals in a way that they'll be able to access quickly and that will fit with their clinical workflow. So healthcare professionals say they need to keep updated, but they don't have much time. So they don't have hours to read long documents. Increasingly, they say to us they've got seconds or minutes and need the information quickly.
So
And
you
and so so
so
that's one of the
you would
challenges that we
say,
try and fulfill as well.
yeah. So you would say that peer-reviewed articles and journals would be considered research that people can trust.
I would say that that's a kind of a minimum standard you'd expect, that content would be independently peer reviewed, that it would be in in indexed journal, and ideally a high ranking journal like the BMJ, but there's a range of other high ranking journals with respected with good impact factors and with respected editorial teams and independent peer reviewers as well who can create the content. That's kind of the minimal expected. Like I think there's a lot of misinformation and disinformation out there on COVID and other diseases, but with COVID and social media, it somehow has got worse. So we need to be careful of and beware of that in information and ensure we use reliable resources to base our decisions on.
And if you were to give the general public a kind of a checklist of the things that they should check off when determining whether some information is valid or not, could you just give us a simple kind of list of things that they should be looking for?
Well, on BMJ Best Practice, we have patient information leaflets. And so this has given us a good deal of experience in this area. So alongside the content for professionals that we expect doctors and other healthcare professionals to read and use, we also have patient information leaflets on COVID. And these patient information leaflets are much shorter. Um, they're written in layperson's language, but they parallel the professional content. So the content is evidence-based and continually updated in line with the professional content. And that's the gold standard that we'd expect. We don't expect uh, patients to have medical qualifications, but I think the ideal is that when doctors and patients and other healthcare professionals are all singing from the same hymn sheet, basically.
Right. So you've written over 200 articles and 4 books. And so I would trust your perspective on kind of the research articles and the type of work that goes into coming up with these things. I think a big part of when we're looking at this pandemic, whether it be about vaccines or the testing, a lot of it is around trust and ensuring that the information that we're taking in to make decisions on our own lives and things that we would choose to do, whether we get vaccinated vaccinated or not, whether we take the test or not, whether we adhere to some of the policies that are that the government puts out in terms of staying away from people or not shaking hands or washing your hands and some of those things. We rely on others to show us that the evidence is there for those things. So it's important for us to follow and to seek out the right kind of information, especially when it comes to this pandemic, when there's so much information out there and you have to really figure out which information to believe. So when we're talking about the pandemic and specifically, we're at this point where we see the light at the end of the tunnel, hopefully, right? Vaccines are out there. People are getting vaccinated daily. We're up to, I believe, 900 people vaccinated here in Bermuda. But we have to get around to 60 or 70% of the population vaccinated. And I believe that is the adult population vaccinated to reach this thing called herd immunity. Just wanted to get your sense of how things are going over there in the UK and some of the things that you at least have seen within the public space that may be helpful for us here in Bermuda around vaccinations or trusting the information that's out there. And then we'll touch a little bit about, a specific population that you're familiar with, which is the older population.
Yeah, absolutely. You're right that ultimately the only way out of this dilemma, very serious dilemma that the UK and other countries find themselves in, is through vaccination. And the vaccine program in the UK is progressing. And I don't know the exact numbers in the past 24 hours, but they're accelerating the delivery of the vaccination program. There's a number of different vaccines available. Some vaccines require repeat doses, which is a challenge for healthcare systems to deliver. It seems thus far that the vaccines are well tolerated and there are relatively few contraindications. One of the challenges that we have is overcoming vaccine hesitancy. It's not something specific to COVID, and it's not really all that new either. In, I think, 2019, the World Health Organization mentioned threats to global health, and one of the major threats was vaccine hesitancy. And so we've been here before with concerns about the MMR vaccine or other such childhood or adult vaccines. So I think, how do we overcome vaccine hesitancy is one of the really key questions. And it's through knowledge and transferring knowledge and making knowledge available. But it's not just knowledge, I don't think. I think it's also about trust and about culture and about finding out what the concerns might be in different countries or in different cultures or amongst different age groups, and addressing those. And you mentioned trust a minute ago, and it's really very important. But when you drill down and ask what's underneath trust, and BMJ is thankfully a trusted brand, but why? We think it comes through independence. And so I mentioned in earlier answers, we have independent peer reviewers, and we go out of house to independent authors, etc., etc. It's also about being transparent, about transparency, about how we produce the content, and transparent about who the authors are. We ask authors whether they have any competing interests, and we ask them to declare that, and we print those any such competing interests alongside the resource. So I think those are the means to overcome this thorny issue of vaccine hesitancy, or at least they're some of the means.
Mm. One of the big things that people have always mentioned when it comes to the vaccine is the pace by which it was developed. And I don't want to go into the technical details of how, the vectors and so forth and so on, but you talked about learning and, information that's being put forth in the research. How are we getting to learn so much in the science realm so fast, right? Is there anything that we're doing in terms of our transparency and our research articles that we're putting out that we're getting better results faster now than we ever have before? And what can you just talk about kind of the pace of learning and being able to come up with a vaccine within a year instead of 3 or 4 years, or back in the day when it would have taken 10 years?
Yeah. Like when you think back a year ago, if people said you'll have a vaccine in 2020, people would have said you're being wildly optimistic. It could be anything between 3 or 10 years by the time we get there. I guess it's just part of the enormous uh, effort and the enormous resources that have been put behind developing a vaccine. It's been a team-based approach, and it's used expertise from multiple sectors. Now, BMJ and publishers more widely, we play a role in making the evidence available and publishing papers related to that. And so we've had to speed up our processes as well to get the evidence out there as quickly as possible. Um, but also we've got to ensure that the content is of high, excuse me, as high quality as possible and as reliable as possible, and hence me talking about the processes that are behind BMJ best practice to make sure that we can trust the content and it is evidence based, and at the same time that it's continually updated. So BMJ best practice is interesting because a few years ago we used to update the content once a year, but even 3 or 4 years ago, we realized this isn't often enough for many topics which are changing all the time. And so our COVID topic has changed every day for the past 11 months now. It's just remarkable. But we did have warnings of it, I think, as a community, and also ourselves at BMJ. So we've had Zika, we've had Ebola, we've had swine flu. So people might say this has all come out of the blue, but has it really? We've had warnings over the past 10 years that something like this might happen. And I think we've made progress over those years and developed certain preparations, but clearly there'll be a lot of learning to do from what's happened over the past 12 months.
One of the things that we haven't made progress on is reversing aging. We haven't stopped people from aging. People still age, and with aging comes, different impacts on their lives. Can you just talk about what the natural course of aging and why are people as they get older more susceptible to complications from something like COVID, and more at risk of serious complications and death as you get older? What happens to the body as we age? Not everyone knows because we've never been there, but I just assume that you get weaker. But there are some physiological things that happen as you age that make you more susceptible to things like infections, COVID complications, and so forth.
Yeah, well, one thing we learned pretty quickly in COVID from the first few months of the pandemic is that elderly people were much more likely to become seriously ill when they're infected. But not just elderly people, and it wasn't just chronological age per se. It was also the number, whether they had any pre-existing diseases or comorbidities before that they became infected with COVID. And these pre-existing diseases were no surprise. They were all common, non-communicable diseases, chronic diseases, things like hypertension, coronary artery disease, heart failure, COPD, dementia, diabetes, sometimes mental health comorbidities as well. And it was those patients who had a combination of non-communicable diseases, and often these diseases are concordant insofar as they occur together and they cluster together in the same person. So it's not unusual to have an 80-year-old patient who has hypertension, coronary heart disease, heart failure, type 2 diabetes, et cetera, et cetera, et cetera. And it was those patients who were particularly affected by COVID-19. And it's those patients who are, it's a particular challenge to manage. And I'm happy to talk further about that in a minute or two also.
Yeah, I mean, that's the specific thing, right? So managing people who are living with chronic disease and putting them in a better position where their bodies can fight off infections, fight off viruses, fight off the diseases that come from viruses. That's an important part of kind of a public health thing. From a public health standpoint, we're learning more and more about how these chronic diseases evolve over time in terms of a population, how behavior leads to, the body taking on some of these diseases. And we're still trying to figure out how to fix that. And in the light of a pandemic, when it becomes so much more evident that we need to really address these underlying chronic conditions and comorbidities, we need as much help as possible. And I know the research is continuing to evolve in this area, but it seems like it's not happening fast enough in terms of our solutions to these problems. So is there anything that you and your colleagues talk about, or that the journals kind of put out there that can be best practices for dealing with chronic conditions as people age? Not that you have to age with sickness. We should all be striving to age well, but it just happens that we have a high prevalence of chronic disease as we get older.
Yes, so this putting COVID aside for a minute, you're right. I think it's World Health Organization statement of health is not just the absence of disease, it's also about feeling well and well-being, which is all about exercise and diet, also about mental health. And in with elderly people, it's about being able to do things for yourself, and even as straightforward as things as being able to live independently in your own home. Before COVID, one of the important movements in medicine and healthcare is the so-called "what matters to me" or "what matters to you" movement. And so this has been championed by various people from the Institute of Healthcare Improvement and elsewhere around the world. The idea being we should ask all patients, but in particularly elderly patients, I think, what matters to you? Is it your cholesterol level or your hemoglobin A1C level, or is it that you're able to live at home with your family, or that you're able to go for a walk every day, or see friends, etc., etc. And those are the things we should be aiming at. But of course, even if you don't catch COVID, it's a challenge in the current environment because people are self-isolating or shielding. People might want to exercise, but that might be a challenge if they can't go to a gym because the gym is closed, or they're told they have to stay at home. Maintaining a healthy diet and a healthy weight is a challenge for all of us in the current situation, and social isolation can result in problems for all people, but particularly for elderly people in the current situation, where we want to reduce mixing, to reduce to reduce the spread of the virus. And we say there are other means. You can use video conferencing software to talk to other people, but of course, not all older people are au fait with such software, and so we got to think about the digital exclusion as well, and got to drive digital inclusion. So it's a long answer. There's so many challenges, so many things we got to think about when we think about the about elderly people. But it is a problem. All populations across the world are aging, and we used to just talk about it as a problem of the West, but in fact, all populations around the world are now aging.
Yeah, you brought in a lot around mental health, right? And I think people usually think of mental health as a risk factor when it comes to getting sick from COVID. It just seems like it's a separate thing that we don't really have to worry about when it comes to physical ailments. One of the things that we have done, we understand here that a lot of social isolation leads to stresses and leads to people not following the proper diets and so forth. So one of the things that we have here in Bermuda is a mental wellness hotline that people can call, especially those who are feeling isolated, those who are having concerns around caring for their loved ones. So here in Bermuda, we have a line. It's 543-1111, which people can call at any point in time during the afternoon hours to talk to someone. And I think sometimes that's just important, to talk to someone, to let go some of that stress, to feel as though you're part of a community again, which COVID has really disconnected a lot of us. I was just saying to a friend earlier today, I just want things to get back to normal, where you can hug, you can shake a hand, you can go into movies and laugh. And there's a lot of things that we would love to do that COVID is stopping us from doing. So, when you talk about mental health, when you think about a lot of these things, it really does have a really strong impact on mental health. I do want to get back to one of the things you talked about and maybe push back. So this idea of I believe it was, it's not what would you like, but in terms of what's important to you in terms of health. Why does it matter what's important to someone if diseases and viruses they don't discern whether you want a higher, you want to laugh more, or you enjoy playing football, or like diseases don't matter or don't discern when it comes to those kind of things. So the approach of, what matters to you, how does
Sorry, Ricky. You broke up for a second there. I missed that last 20 seconds. Sorry.
So I guess the question was, in terms of this idea of what matters to you, and I look at it more of as a customized approach to optimizing people's desires or their preferences when it comes to the health state, and practicing medicine to account for that. How does that truly, from a public health standpoint, how does that approach help when it comes to diseases and viruses that don't really care who you are and what you prefer, but they're willing to affect your outcomes negatively anyway?
Yeah, that's a good question, really, and it is a challenge. And I think that when I was talking about what matters to me, it wasn't really in the context of COVID-19, but rather in the context of healthy aging, and as thinking about the mental well-being of all our patients, including our elderly patients. And I don't want to suggest that that mental health comorbidities are a risk factor for COVID, but rather that the situations that the COVID pandemic has put us all in increase the risk of mental illness. And indeed, if you have COVID and you're unlucky enough to get some kind of a post-COVID syndrome or long COVID, then once again, you could be at increased risk of mental health complications, including depression. To come back to try and answer your question, I guess the COVID pandemic has forced us to think about what's best for ourselves, but also what's best for the population as a whole, and what matters for all of us as a community. And so mask wearing is a case in point. You're partly wearing a mask to protect yourself, but equally wearing a mask to protect everybody else. And so that's genuinely what public health should be about.
Yeah, and I think even one of the things that people are maybe a little confused about, but even once you get a vaccine, we still need to do those things like masking up and social distancing or physical distancing. We still have to do those things for the near future. I personally can't wait to get the vaccine. I am excited to get the vaccine. I know I have to wait my turn though. I don't fall into one of those kind of high priority categories yet. I'm not a frontline healthcare worker. I'm not over the age of 80. I haven't hit the age of 65, which I think is phase 2 here in Bermuda. So I'm going to wait my turn just like everyone else in terms of the general population that doesn't have some of these comorbidities. But I do urge those who do fall within those categories, protect yourself. Protect yourself, because not only do you want to protect yourself, but you want to protect your family against anything that may happen to you. It's not just a selfish decision to get a vaccine, but it's also takes into account, what your contribution is to your family and your community in general. So I am excited to get it. I've seen some of the octogenarians receive it here in Bermuda over the last few days, and they've been in a while. So just in terms of your perspective on your personal view of taking the vaccine, and is there any tips or any advice that you can give to the public here in Bermuda?
Yeah, sure. Ricky, you and I, we're too young to be vaccinated for the moment. But our turn will come, and so similarly, I'll be in, like, the priorities in the UK has been care home residents, elderly people, and people with pre-existing chronic diseases, and indeed frontline healthcare workers. But of course, when the time comes, I'll be queuing up to get the vaccine as eagerly as everybody else. In terms of advice to members of the public or other healthcare professionals, it's kind of to stay informed, and to base all decisions about healthcare on good evidence, which you can only get through reliable resources, and resources that are current and that are continually updated, which of course is really important in the fast changing world we find ourselves at the moment because of the pandemic.
And just
Sorry, Ricky, you're breaking up slightly now again.
guidance.
Sorry, Ricky, you broke up again there.
Froze. The other peer-reviewed documents, how far back should we be looking for the most recent guidance? Should we be looking 3 months ago, or should we be looking at the last month or so when it comes to the most recent information?
Okay, so I think it depends really. Like for things like vaccines, the information is only a few weeks old, literally for some of it. And similarly for treatments, I'd look at the most recent publications. For other things related to the epidemiology of COVID or etiology of COVID, of course, we can go further back to the early months of 2020 and look at those papers and learn a lot from those papers. But I think if it's about treatment or vaccines or prevention, then it's the most recent content we need to be looking at.
If you were to give everyone a list of how to get on BMJ, what's the BMJ? Sorry, what is the website?
Yeah, so the website is the website is BMJ Best Practice Comorbidity, BMJ Best Practice, which is our clinical decision support tool. But also we've got an add-on to the website called BMJ Best Practice Comorbidities, which we created before the COVID pandemic, but it was a timely thing to do, because then we were able to add the comorbidities tool to the COVID topic. And of course, when you're managing a patient with COVID with multiple comorbidities, what a challenge it is. So you might say, okay, this patient has COVID, they need to start dexamethasone. What if they also have diabetes? What effect will dexamethasone have there? What if they have depression? What effect will dexamethasone have there? You're going to start fluids, but what about heart failure and chronic kidney disease? What about drug doses in the context of chronic kidney disease? The patient might need oxygen. But what if they've got COPD? The patient might need low molecular weight heparin because we know these patients clot. What if they've got chronic kidney disease? What about non-steroidals in pre-existing illnesses? If they've got COPD, will nebulizers spread the virus? Should they avoid nebulizers? What about the benefits and risks of ACE inhibition? And for those that start to recover, how will we rehabilitate those patients? So there's just such an enormous challenge. How do you stay across all those things? How do you take all those things into account in making your treatment decisions? And that's why we've created BMJ Best Practice comorbidities to help healthcare professionals make those decisions and to provide them with guidance on how to manage patients with COVID plus hypertension or COVID plus diabetes or COVID plus hypertension and diabetes, etc. Sorry, Ricky, I'm afraid you've frozen again. Ricky, sorry, I'm afraid you've frozen again.
I'm back.
Great.
But yeah, you listed a lot of different things when it comes to the considerations of treatment. You also mentioned a few minutes ago around COVID could have lasting impacts 6 months down the line. Is there something that individuals can do with their doctors to ensure that they're managing those things if they do end up with COVID?
So-called long COVID is like everything else related to COVID, really very new. There are resources out there, not just from BMJ Best Practice, but from other reliable outlets and publications where you can find out how to manage patients, how to diagnose patients with long COVID and then try to manage it. I think that recognition is first step in these things, like everything else. And also, I think it's likely that an interdisciplinary approach will be needed for these patients.
Okay, so definitely working with teams of physicians or teams of specialists to make sure that we're not only dealing with the diabetes, not only dealing with the hypertension if someone has those comorbidities, but dealing with the respiratory areas that come with COVID, other, the mental health challenges that may come with the whole environment. So it sounds like a team approach is the best approach when it comes to managing individuals who may come down with COVID.
Absolutely, and I think that's true of elderly care more generally, but certainly in the case of patients with comorbidities, they need a generalist to look after them and a team-based approach also, because no one person can know how to manage all these different illnesses.
What is we have a question from the public around allergic reactions. I know some of the guidance has been for those who have severe reactions to vaccines, that there should be some caution, or they should not be the ones who are taking the vaccine. I think some people have maybe confused that with if you have an allergic reaction to, let's say, honey, or you're allergic to honey, that also goes with vaccines. But I've seen, I guess, in the literature that it's more so if you've had allergic reactions in the past to vaccines, that's more so the factor. Can you just talk about, one, how to be cautious when it comes to allergic reactions, and anything that you may know about what the different vaccines that are on the market, whether they are they lead people to be more susceptible to allergic reactions or not, based on the vaccine itself?
Yeah, so I would recommend everyone to go to their local formulary and check that really for the any contraindications or cautions related to the vaccine. I can only look at the content on BMJ Best Practice that was updated as of 24 hours ago, and it says the contraindication is hypersensitivity to active substance or any excipients, and an immediate allergic reaction to the first dose. Those patients should not get a second dose. That's what it currently says in the BMJ Best Practice topic.
And just so the public knows, when you do get your vaccine, there is a 15-minute kind of observation period after receiving your vaccine. So it's not like getting your flu shot where it's in and out, but there is medical personnel who will be watching you for 15 minutes. So
Sorry, Ricky, you've frozen again, I'm afraid.
it feels, you know what it feels like? It feels like our internet connection has COVID, is COVID positive today. But I think I was just making the point that for those who are fearful of the vaccine, just know that there are medical personnel who will be on hand. So if you do have some kind of allergic reaction, adverse reaction to the vaccine, there are people who know what to do. So they're not just going to leave you to deal with that reaction yourself. There are going to be people who are watching over you. So that's an important part so people have comfort when it comes to the process of getting the vaccine. Any other questions from the public? I know that I know that there's a lot of information out there, and I think we've all heard different stories about vaccines. We all have a lot of information that we've watched in the news, the news reports, and we all feel pretty educated around the topic. But I think it is important to get different perspectives and to have timely perspectives, because things do change on a daily basis. And for those who are questioning where to go to find good information, forums like this do provide you a outlet or some tools that you can use if you need to look up some of the information yourself to become educated and make, informed decisions. Because one of the things that we don't want the public to do is make decisions either based on anecdotes or just because someone told you to. But we want you to actually get out there and really get the evidence for yourself and learn the information so that you can, if you need to pass that on to someone else, you can feel comfortable doing that and feel like it's coming from a reputable place. This pandemic has showed that we all have to lean on a lot of trust in the information, but we also have to have enough sophistication to understand how to parse through the information as to what's good information and what's not good information, And if we find that it's not good information, try our best not to share it. Because one of the things that we've mentioned today, and I think it's not just been around this vaccine, this pandemic, but it's been around politics and a lot of other things in the global society, that's misinformation and disinformation campaigns that are very effective. So we have to be even more cognizant as members of the public to, find our information at good sources. So Dr. Walsh, I think one of the things that we've learned today is how to trust in the information that's out there, how to find reputable sources. We've learned that mental health and aging don't have to be the kind of a weight on us. But if we work together with our physicians, we can manage not only the aging process so that we can manage our chronic diseases better, so that when things like COVID do come, we can be less concerned. But we do need to be familiar with the tools that are out there. In Bermuda, we have a website, www.gov.bm/vaccines, for questions around the vaccines. If we need to find you, Dr. Walsh, we can look at, where can we find you?
If you Google BMJ Best Practice, you'll find the resource.
Okay. Again, for those who are in line or on the fence around getting the vaccine, please do some research on your own to give you some comfort as to what is happening with the vaccines that are coming out. Also go to the government website. Also ask those who have, look at testimonials of those who have had the vaccine, to so that you can feel more comfortable doing so. Remember, once you get the vaccine, and even before you get the vaccine, remember to mask up. Remember to social distance or physical distance. Remember to stay out of closed, confined, non-ventilated spaces. All those things are going to be important, not only for the short term, but for the long term. We are not getting back to normal within the next few months. So we're going to have to continue to do these things that are going to mitigate some of those risk factors from allowing this virus to spread within our community. So Dr. Walsh, I just want to thank you so much for providing your insights and some of your knowledge around these areas. And we do have your link to bestpractice.bmj.com for people to look up. And we hope that at any point in time, as the information comes out, we can reach back out to you and find out some best practices that we in Bermuda can use as we go forward in fighting against this pandemic. And the same, whenever you come to Bermuda, make sure to get your travel authorization and have a negative pre-test. But you're welcome to come as long as you are not bringing COVID with you. I think that is the message. Be careful in protecting ourselves and protecting those around us. So again, thank you for being our honored guest today on the Bermuda Health Council community discussion. And with that, if there's any last words that you'd like to say.
No, just thank you very much. It's been great, really helpful discussion, and lots of interesting questions and things to debate. And absolutely, we'd be delighted to explore with you further with the council how we could make BMJ Best Practice more widely available. Thank you.
Thank you so much. And for everyone else, have a good rest of your Thursday afternoon.